My name is Jensen Henry, and I'm one of the foot and ankle surgeons here at HSS.
I see patients of all ages with a wide variety of problems. I see teenagers all the way up to people in their 80s and 90s. I see people with acute problems like ankle fractures and Achilles tendon ruptures. I see people with chronic problems like deformity of the foot or arthritis of the foot and ankle. The beauty of what I do is that I get to see all ages, all diagnoses. The common conditions I treat in the foot and ankle are probably first and foremost ankle arthritis, which is wearing of the cartilage at the ankle joint. I also treat arthritis throughout the foot and ankle. So again, injury to the cartilage or wearing away of the cartilage at the joints in the foot and ankle. I commonly treat acute injuries like sports injuries, Achilles tendon ruptures, or ankle fractures, ankle sprains. But then I also will treat chronic problems that people have had for years.
My approach to patient care is, first of all, realize that I am treating a patient, not an x-ray. I think lots of people will come in with an x-ray that's similar, but depending on what the patient's telling me about how bad their symptoms are, about what they want to get back to, about what their life is, their job is, those patients might get different treatments based on those differences in their symptoms, their goals, and their expectations. One of my big passions in life, in research and in clinical care, is ankle arthritis and ankle replacement. And a lot of people who have ankle arthritis in the country and in the world don't know that ankle replacement is an option. Patient education is the most important thing. It is as important as what I do in a surgery, and it's as important as the post-surgery recovery period. Patients do best when they understand what their problem is, what the expectations of surgery or the other treatment plan are, and where the goalposts are in terms of their recovery. Seeing success in a patient is the greatest feeling in the world for a physician. It's absolutely incredible because we put so much energy and care and thought and dedication into getting the right outcomes for our patients and getting the best outcomes for our patients. And so to see that patient succeed, it feels like the greatest team victory on the planet.